A vaginal yeast infection, also known as vulvovaginal candidiasis, is a common condition. It happens when there's an overgrowth of yeast in the vagina. This overgrowth disrupts the natural balance of microorganisms, leading to discomfort and irritation. While it can be bothersome, it's usually not serious and can be easily treated. Many women experience yeast infections at some point in their lives. Knowing the causes, symptoms, and treatment options can help you manage and prevent future infections. Understanding your body and its signals is crucial for overall well-being. The most common culprit behind these infections is a type of yeast called Candida albicans. Candida is a normal resident of the vagina, existing in small numbers alongside other microorganisms like bacteria. This delicate ecosystem maintains a healthy vaginal environment. However, certain factors can disrupt this balance, causing Candida to multiply rapidly. This overgrowth leads to the uncomfortable symptoms associated with a yeast infection. Several factors can trigger the overgrowth of Candida albicans, increasing the risk of developing a yeast infection. Understanding these triggers is crucial for prevention. Antibiotics, while essential for fighting bacterial infections, can also kill off beneficial bacteria in the vagina, allowing Candida to thrive. Hormonal changes like fluctuations in estrogen levels during pregnancy, menstruation, or hormone therapy can create an environment conducive to yeast overgrowth. Douching and harsh soaps can disrupt the vagina's natural pH balance, making it more susceptible to infection. A weakened immune system, due to conditions or medications that suppress it, can increase the likelihood of yeast infections. Lastly, high blood sugar levels in diabetic individuals can promote yeast growth, making them more prone to infections. Section 4. Recognizing the symptoms. Vaginal yeast infections manifest with a range of symptoms. Although some women may experience no symptoms at all, recognizing these signs is essential for seeking timely treatment. Itching and irritation. Intense itching in and around the vagina is a hallmark symptom. Burning sensation. A burning sensation, especially during urination or intercourse, can be a sign of infection. Abnormal discharge. Thick, white, cottage cheese-like discharge is characteristic of a yeast infection. However, the discharge can also be watery or odorless. Redness and swelling. The vulva, the outer part of the vagina, may appear red, swollen, and irritated. Pain during intercourse. Yeast infections can cause pain or discomfort during sexual intercourse. Section 5. Diagnosis and treatment. Seeking expert help. If you suspect a yeast infection, it's crucial to consult a healthcare professional for an accurate diagnosis and appropriate treatment. Self-treating can be risky, as other conditions may have similar symptoms. Pelvic exam. Your doctor will likely perform a pelvic exam to visually examine the vagina and vulva for signs of infection. Vaginal pH test. A simple test can determine the acidity of the vagina, as yeast infections typically elevate pH levels. Microscopic examination. A sample of vaginal discharge may be examined under a microscope to confirm the presence of Candida. Treatment usually involves antifungal medications available in various forms, including creams, ointments, suppositories, or oral tablets. Your doctor will recommend the most suitable option based on the severity of your symptoms and medical history. Section 6. Prevention and self-care. Tips for a healthy vagina. Preventing yeast infections involves maintaining a healthy vaginal environment and minimizing risk factors. Here are some tips for prevention. Wear breathable underwear. Choose cotton underwear and avoid tight-fitting pants to allow for air circulation. Practice good hygiene. Wash the genital area gently with mild, unscented soap and water. Avoid douching. Manage diabetes. Keep blood sugar levels under control to prevent yeast overgrowth. Avoid scented products. Scented soaps, bubble baths, and feminine hygiene products can disrupt the vaginal pH balance. Wipe front to back. After using the toilet, wipe from front to back to prevent bacteria from spreading to the vagina. Change out of wet clothes promptly. Moisture can encourage yeast growth, so change out of wet swimsuits or sweaty workout clothes as soon as possible. Yeast infections are a common and treatable condition. By understanding the causes, symptoms, and prevention strategies, you can take charge of your vaginal health. If you have any concerns or experience recurrent infections, consult your healthcare provider for personalized advice.